Sinds 25 april vertoeft in Suriname een Indiase handelsdelegatie. Vandaag in Waakhond 2 mensen van deze delegatie, aan wie ik als eerst ga vragen om zich even voor te stellen.
My name is Dr. Srivatsa. I've come here to help the healthcare system and see if I can contribute something to the welfare of the community in regards.
What I understand is that you have developed a very innovative app. Maybe you can share your experience with that app with the population of our country?
Yes, app is an add-on to the initial work I did. My major work is to do with understanding what makes a patient or a person who's sick, a father or a mother of a child, access healthcare. Why do they go to see a doctor and with what problems they do go? So when I analyzed that, I came across a very interesting concept where I could bifurcate it into 2 segments. One is a serious illness which family doctors cannot help. You have to go to the hospital. The other one is the one which can be managed in the community. So using these 2 criteria, I developed a small tool where I differentiate between serious and not serious, or well and unwell. The symptoms which you are going to see on my app or the software are the ones which does not require any input. So my tool is 100% safe. I have not created it in one day. I have taken 10 years to develop this hypothesis.
Okay, and you are a medical doctor yourself, you're a medical specialist. Can you tell us something more about your previous experience?
I am a doctor who worked in pediatric intensive care and critical care for almost 20-25 years. My job was to train my junior doctors and medical students how to learn and act and decide what to do when the patient presents to them with a symptom. In other words, they should be able to work in the community and differentiate between common illness and serious illness and make sure that they send the serious illness straight away to the hospital and handle the common ones. This is what I have been training for almost 20-25 years. And when I worked in England, we get new batch every 6 months. So in other words, I have repeated the same kind of process for almost 40 times. And based on that, I've come out with this app, and I can deliver healthcare at a cost which every country in the world should be able to offer basic healthcare free of cost.
But for who is this app intended? Is it for the doctor or is it for the patient?
This is actually targeting patients because I want the people to understand when they should consult a doctor. Without understanding, just because I have pain in the head or I'm coughing, they get very anxious and they run to the clinic to see a doctor like me. And when they come down, actually there is absolutely nothing I can do to this symptom. It might be just a common thing which goes away 1 or 2 days. But there are similar symptoms which are actually serious. But how do you differentiate these 2 from a common cough to a serious cough? My app helps you to differentiate these 2.
So the doctors must not be very happy with your app.
Actually, it helps them because it reduces the number of wasted consultations. We see 10 patients a day in the morning. Out of that, 6 to 8 of them shouldn't have been there. So only I should have spent time on 4 patients. So now it gives me whole morning to spend the time with a patient who needs my help.
Okay, and how about how does someone know that the information that is in the app is correct, and that, for instance, if something goes wrong, that the app says, well, you don't have to go to the doctor, but it seems if you follow the story of the patient, that later on he or she should have gone to the doctor. What can this situation appear?
I knew this problem. So when I started work, initially I selected 12 symptoms which are common. I tested this hypothesis. A year later, I took away 3 symptoms out of that. The reason was any of these symptoms I had to see a patient, or I had to do any examination like checking the blood pressure, looking at the eyes, feeling the pulse, whatever it is. I took 3 symptoms off.
Okay, you have also visited some hospitals.
Yes.
Did you, in what way do you think that you yourself and maybe other members of the delegation can be of benefit for the healthcare sector in Suriname besides the app that you already mentioned?
I've traveled around quite a lot. The healthcare system here is pretty old-fashioned. We have moved forward and we are using innovative technologies, innovative approaches, utilizing non-medical staff for various other alternatives. So I have been discussing with the directors of hospitals and private investors in this country who have private clinics, offering services to the main hospital, and trying to integrate these two, and not only that, hoping that I can create a health center where services from expertise from India, so basically IVF, cardiac surgery, various specialties, can be outsourced here, where we do the primary investigations for American patients, because we are trying to bring in patients and services at a cost which can be affordable. The American system cost is too high and people are looking for cheaper alternatives but with the expertise. So I have been discussing this morning, I discussed with a private investor who is keen to bring specialist doctors from England to here to offer a service on a contract. So hopefully I'll be able to successfully have a private sector providing the services and care for the local community as a secondary care. The government hospital who can't afford to equip, who can't afford to get specialist staff employed with expertise, they could come to the private sector where at a cheaper cost they could utilize the services. So 2 or 3 countries put together, I think we'll have a very good comprehensive, because the location is brilliant, the environment is good, it is healthy, because with 90% of trees around, I don't think any other country has this novelty. And that will be good for giving Ayurveda, homeopathy and all this. That is what I'm trying to do, is integrate the whole healthcare system into one package, utilize the best of each and everything, make sure the cost goes down, and definitely I don't want people to be crowding up in the hospital. The more crowds we have, the more infection occurs. Cross-infection is going to be a major problem in the next 5 years, and I think we must address that right now, otherwise it is going to be a threat to the medical profession itself. Infection is one we have to be very careful. If we don't stop abusing antibiotic, if we don't identify early, the whole community is going to be on wildfire, and that is what I'm trying to avert.
Okay, well, that is these are quite a number of plans. I would like to wish you all the best of success with all these plans, and we do hope that they can be executed on a very short note, in a very short time period,
Sure.
which will be of benefit both to the peoples of Suriname and India as well.
Sure.
So may I wish you, gentlemen, and your whole delegation a very safe trip back to India.
Thank you very much.
Thank you very much.
Thank you.